and lots more on the show as well. Yesterday, Catherine was on the quiz, and she mentioned that she'd lost her husband in his 40s to a heart attack. And he had no symptoms, just gone. And I was saying, and I sort of looked it up last night just to confirm that my memory was serving me well. It's 50% of people who die of heart attacks have no previous medical history of heart complaints. So they have a heart attack and that's it, gone. And if you spoke to their loved ones, no history whatsoever. Anyway, David O'Connor sent us an email on the topic. He says, listen to your show today and you spoke to a nice lady, Catherine, who lost her husband probably in his 40s to a heart attack. You see, the problem is we are all living our lives under plenty of stress, and that plus hereditary issues means you can be hit with a heart attack from typically your 40s onwards, says David. It's probably the most unnecessary way to die that I can think of, and the collateral damage thereafter for family, especially young families, can't be put into words. I've been in the hotel industry, says David, all my life, and there's nothing more stressful than running a 24/7 business. I discovered at 30 that I had a cholesterol level of 10.5, which is as close to dropping on the spot as you will get, as 4 to under 5 is normal cholesterol level. I was on medication for 20 years. My blood pressure was always fine, but started to go up when I was 49. I went on working like an idiot that year for most of the year, not realising that at any moment I could drop dead. For my 50th birthday, my wife Anya was bringing myself and our boys to New York, and a couple of months earlier I said I'd get a full MOT due to my medicated cholesterol and blood pressure issue. I particularly wanted an angiogram to be sure. All was fine going for the checkup and running on the treadmill, and I was stopped halfway through as the nurse wasn't happy with the readings, so an angiogram was arranged a few days later. The cardiologist said to me as he was inserting the tube, "We don't often get people like you coming in requesting an angiogram," but I told him it was my doctor who also felt I should get it done on account of the blood pressure and cholesterol history. Cut a long story short, the cardiologist said that I had in excess of 95% blockage of the widowmaker artery. That's one of the main arteries in your heart. He said, "You would be dead before you hit the ground in New York. And only for I stopped smoking years earlier, I certainly wouldn't have made it to the surgeon's table." As a result of asking for the angiogram, I had done no damage to the heart, and the cardiologist inserted a stent while he was talking to me. And I was home that evening without even an overnight to check out the hospital food. On the way out, the cardiologist quietly said to my wife that I wouldn't have made it to New York as the flight would have killed me. No happier man kissing the tarmac when I got off the plane in New York, I can tell you. I'm seriously into windsurfing since, and it's a great way to keep your cardiovascular exercise on the go and enjoying it at the same time. Ray, there needs to be a nationwide health alert like breast cancer for men and women, but especially men, to ensure they know exactly what their cholesterol and blood pressure levels are at. In knowing those two levels, it is likely you either have no problem or you can be medicated with a couple of tablets daily. This is the difference between life and death, and it's so simple really. It's quite scary the amount of people who simply haven't a clue what their cholesterol or blood pressure levels are at. Not a clue. From 40 onwards, know your cholesterol and blood pressure once a year, every year, and this will avoid unnecessary loss of young life and grieving families. If there are any issues, they can be easily dealt with. It's that simple. And that's David O'Connor, Athenry, Galway. Lucky man, and he knows he's a lucky man, and that's why he's telling his story to us so we can tell it to you. And it's from 40, they're saying, men, you have to go and get the full MOT, find out about your cholesterol, your blood pressure, because you can prevent. Heart attacks are very preventable. Statins, aspirin, blood pressure tablets, there's millions of people all over the world on those on a daily basis, and they're preventing heart attacks. They say 40 for men and 50 for women. So go to it. If that's struck a chord with you, act on it now.